Hi, Elise.
Hi.
I'm going to go ahead and do the physical assessment on you.
Okay.
Let me go ahead and raise the bed up so I don't have to break my back.
Okay.
I'm first going to start with your head and skull and check your hair. Feel for any deformities. Don't feel any there.
Okay.
While I'm feeling, I'm going to go ahead and feel for the lymph nodes, occipital, and the post-auricular, pre-auricular, tonsillar, submandibular, and submental.
Okay.
I'm going to go ahead and feel for the anterior cervical chain and the posterior cervical chain, supraclavicular nodes, and also the infraclavicular nodes. I'm going to assess for symmetry of the face, and your face does look symmetrical. I'm going to check the eyebrows, eyelashes, eyelids, check the sclera and the conjunctiva of the eyes. That looks good. Can you raise your eyebrows for me? And can you show your teeth? And can you pucker your lips, blow out your cheeks? Okay, and that's all testing cranial nerve number 7, the facial nerve. I'm going to go ahead and, before I check your eyes, I'm going to check, go ahead and clench your teeth together, open your jaw. Okay, and that is checking for cranial nerve number 5, trigeminal. Going to check perla in your eyes. Oh. Okay, and they're equal and reactive. I'm going to check, that's checking cranial nerve number 4, the trochlear nerve. I'm also going to check cranial light reflex, and that is checking for cranial nerve number 3, oculomotor. Look at my pin here. Look up, look down. And this is testing cranial nerve number 6, abducens. Okay, I'm going to go ahead and feel the bridge of your nose. Good. And keep your head back just a little bit for me. I'm going to look in your nose. Everything looks symmetrical and clear there. Go ahead and open your mouth for me. I'm going to check the teeth, the mucosa, the tongue. Go ahead and say ah. Ah. And that is checking the uvula. That is cranial nerve number 10. Gonna go ahead and cranial nerve number 10, the vagus nerve. Gonna go ahead and check your shoulders. Can you shrug your shoulders for me? Good. That's cranial nerve number 11, spinal accessory. I'm gonna back up just a little bit. Go ahead and stick your tongue out for me and move it from side to side. That's cranial nerve number 12, hypoglossal. Let's see, I'm going to go down to the thoracic cavity. Going to check for some symmetry. Everything looks symmetric. Her breathing, she's breathing in and out. Stethoscope. If I could borrow that from you, thank you. Before I listen to your lung sounds, I'm going to check your ears. Feel your mastoids here. And the tragus, does that hurt if I push on the tragus?
No.
No? And I'm going to go ahead and check your hearing. I'm going to cover one ear, whisper something in your other ear.
67.
Good.
$25.
Good. And that is checking for cranial nerve number 8, acoustic. I'm going to go ahead and have you turn to the side here. I'm going to check her back for symmetry, check the spine. And that's good there. While I'm here, I'm going to check the CVA, the costal line and the vertebral line. Check for any pain there?
No.
Any pain on that side? No. Okay, I'm going to go ahead and listen to her lung sounds. deep breath for me. Okay, go ahead and turn back to the front for me, please. Going to listen to the lung sounds on the front. Deep breath. Good. I'm gonna go ahead and listen to your heart sounds. I'm gonna first feel for the sites, aortic, pulmonary, the herbs, and then give me one. Find where I'm at here. Tricuspid and mitral. So I'm going to go ahead and listen with the diaphragm and the bell. First is aortic, pulmonary, herbs, tricuspid, and mitral. Going to listen with the bell. Aortic, pulmonary, herbs, tricuspid, and mitral, and the PMI at the bottom there in the fifth intercostal space. Gonna also feel for your carotid pulse one at a time, that way we're not passing out here. And listen to that as well. Good. I'm going to go ahead and lay you back. There we go. Let me pull this out so it's more comfortable for you. Go ahead and drape you. I'm going to inspect your abdomen first for any scars. I don't see any pulsations or anything. I'm going to listen to bowel sounds. You've got bowel sounds in all quadrants. Going to fill your belly lightly, and then some deep palpation. Any pain or anything with that?
No.
Okay. At this point, I would also feel for inguinal nodes or femoral pulses. So I'm going to go ahead and go to the extremities, feel both of them. They're both warm. Put your hands here for me. Check for cap refill. Your fingers have good capillary refill. Are you able to bend your wrists for me?
Mm-hmm.
Bend your elbows, shoulders. And let me just check each joint here. And are you able to spread your fingers out? And the joints in your fingers? Good. I'm going to go ahead and expose her legs at this time. I'm going to take your socks off here. Going to feel for some pulses and post-tibial as well. Gonna backtrack just a little bit. I failed to feel your pulses, radial pulses here. Her legs are even in temperature. There's no swelling. She has no deformities, no varicose veins. Can you bend your ankle for me? And your knees. Gonna go ahead and check your hip. Good. Go ahead and relax that one. Bend the knee. Check your hip. She has good muscle strength in all 4 extremities. She's able to full strengthen all of them. Go ahead and sit up for me. Okay, let me just double check where I'm at here. Okay. I'm going to check sensation. I'm going to have you close your eyes. This is a sharp point of an object here, and then the soft edge of it.
Okay.
I'm going to test that through. I'm going to go ahead and take this off of you now.
Okay.
Okay, go ahead and close your eyes.
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp.
Going to pull your pant legs up here.
Sharp. Sorry, I opened my eyes. Dull. Dull. Sharp.
Okay, very good. Going to go ahead and check your reflexes.
Okay.
Going to check the bicep reflex here. The other one. Okay, gonna go ahead and check while I'm here, I'm gonna do the plantar. Go ahead and lift your feet for me. Try that one again. Okay, gonna go ahead and lower this and do the patellar tendon. Right, I'm going to go ahead and have you take your heel of one foot and run it down the length of your shin on the other one.
And the same?
Same on the other side. Very good. I'm going to go ahead and have you take your finger and touch your nose. And then touch my finger. Touch your nose again. Out here. Okay, use your other hand. Touch my finger. Touch your nose out here. Good. Okay, go ahead and stand up for me. Okay. I'm gonna test the Romberg test. I'm gonna have you close your eyes, and I'm gonna test your balance. I have my arm behind you in case you fall.
Okay.
And I would hold this, have you hold it for 30 seconds. That's very good. Can you go ahead and open your eyes? I would like for you to walk heel to toe forward several steps and then backwards for me.
Okay.
There. One more.
Okay.
And then go ahead and walk backwards. Very good. Very good. And I'm going to check your back for scoliosis.
Okay.
If you can, I'm going to first just check the spine. Go ahead and lean forward for me. Touch your toes. And I would feel the back, and I'd like to visualize the spine itself to see if there's any curvature. Okay, go ahead and stand up. I would check, make sure the shoulders and the hips are at the same level and are symmetric. I would have her go ahead and twist side to side for me. And can you bend side this way, forwards and backwards? Very good. You checked out very nice today.
Thank you.